Aloha, this is Dr. Summer Nicole of Yoga Doctors TV. I wanted to jump on and give you guys a quick explanation of what hypopressive breathing is and what low pressure fitness is. So there's a distinction between the two, so I just wanted to clarify it for those of you who are out there searching for these terms or in need of this work. So hypopressive means low pressure. So hypopressive breathing literally means low pressure breathing. And it's actually a breathing technique you may know as the abdominal vacuum technique. If you're a yogi, it has similar effects to true Uddiyana Bandha. So it's a passive lift of a relaxed abdominal wall. So it creates this sort of suction or vacuum look of the abdominal wall. And that breathing technique is in and of itself a breathing technique. What low pressure fitness is, that came around in 2014, Tamara Real and PD Pensac created the brand or the company called Low Pressure Fitness. And what they did is they took the hypopressive breathing technique and they paired it with these specific exercises with specific technical postural cueing to create core and pelvic floor restoration programs. So there's 3 levels of it. I teach this to clients that are healing from prolapse, incontinence. For men, it mostly is like hernias. Men that have hernias, it's the only thing I really know that actually heals the tears in the tissue from hernias, as well as diastasis recti, which is most common in pregnant women where you get a split of the midline of the abdominal wall. And low pressure fitness heals that as well, because there's tears in the tissue and it's healed by this eccentric strengthening that's a part of low pressure fitness. Eccentric just means you're lengthening and contracting your muscles at the same time. So it's low pressure fitness, or LPF, is considered like a revolutionary breath and postural method. And it has a lot of different benefits, not only postural re-education and respiratory improvement. You have the pelvic floor restoration piece of it. Anyone that does it, you naturally get a waistline reduction because it reshapes you from the inside out, and as well as sexual enhancement. So it actually can improve for women that have a hard time coming to orgasm. It can improve that, as well as for some men that have ED. So some of the 3 main characteristics of like hypopressive training, you could say, are number 1 is that it decreases pressure in the thoracic, the abdominal, and the pelvic cavities. That's the main kind of magic of the method, which is when you have too much, you have conditions that are a result of too much intra-abdominal pressure, like when things are bulging outward, like prolapse or hernia. You have to get to the root cause of that, which oftentimes is just too much intra-abdominal pressure. So it's reducing the pressure. So instead of feeling pressure on the pelvic floor, it literally flips that pressure internally. So you feel more of like a lift up on your diaphragm versus like heaviness on the pelvic floor. Another characteristic of hypopressive training is that it turns on the deep core muscles the way they're meant to function, which is synergistically all together at once, and reflexively, meaning automatically. So very different than how like our fitness industry tells us to train the core, which is actively and consciously. So if you've been injured at all, you have to turn on those deep core muscles how they're meant to function, which is synergistically and reflexively. And the other characteristic of hypopressive training is that it helps to normalize the myofascial tension, or you could say the resting tone of the abdominal wall and the pelvic floor. So I would highly recommend, if you're in need of this work, that you definitely work with a teacher. It's very make it hyperpressive, adding pressure and contributing to your problem if you're doing it incorrectly. So I highly recommend working with a teacher. I'm out of Kauai. I see a lot of clients over Zoom. I can teach it through Zoom over video conference. So if you're looking for any recommendations or suggestions, please feel free to reach out to me. I'm going to leave a link under this video for a free gift that's on my website, and that gives you 3 self-assessments for kind of if you need this work, self-assessment for your diaphragm, for your abdominals, and your pelvic floor. And then another video on that same page is an intro to hypopressive breathing. So just give you a little intro of how the basics of the breath work. And please let me know if you have any questions, and please feel free to share this. A lot of people are in a lot of women especially are in need of this work, and they don't know. And a lot of gynecologists or even physical therapists don't know about this work yet, and it's highly effective for a lot of these common women's health issues, as well as hernias, and it just has really good overall effects for benefits. That's why I'm so behind it. So please let me know if you have any questions, and I hope you have a beautiful day. Aloha.